In this quick video, I want to talk about the plan annual notice of change that goes out every year about this time in September, why it's important, and what it could mean for your health insurance. My name is Jamie from meetjamie.com. I'm an independent insurance broker. I'm based out of Minnesota, but I help people in several different states around the country understand the Medicare program and find the coverage that fits their needs. Medicare is always changing, and this is one reason it's good to have an agent or a broker in your corner that can keep up with all of these changes because there are so many of them. So, a lot of people are probably getting some mail right about now from their health insurance company talking about the annual notice of change. And so, the annual notice of change, I'm just looking here on Medicare.gov, is for those people who have a Medicare plan. And it usually comes around September, and it would come from whatever health insurance carrier you are using for your Medicare plan. And so what you should do with this is review any changes to decide whether the plan will continue to meet your needs in the next year, or if you don't get this important document, you can also contact your plan and you would just request the plan annual notice of change. Again, they have it shortened here as ANOC. This is something you want to look at every year, and here is the reason why. So I just was notified of this news story today, or this change today and I found this news story. Here in Minnesota, there's about 13,000 Minnesota seniors on Medicare Advantage that could lose in-network access to their doctors. So if you see this here, it says HealthPartners says its hospitals and clinics won't be in the network next year for Medicare Advantage plans sold by Humana. The insurer still hopes for a new agreement. This is one of the things I always talk to people about when I'm talking about Medicare Advantage. These plans change every single year, and this is a prime example of how that can be. Seniors with Humana Medicare Advantage plans are being told their in-network access to HealthPartners hospitals and clinics. They'll lose, in-network access to HealthPartners hospitals and clinics next year. The move would affect 13,000 Medicare beneficiaries who are covered through Humana, a large Kentucky-based health insurer that has a significant presence in Minnesota. Bloomington-based HealthPartners says the patients will need to either change plans or pay more out of pocket in 2024 to see its network of doctors. HealthPartners is alerting its patients of the change in letters being sent out this month. So this article is actually a little bit older now. This is from June, but I had a phone call today from someone talking about her mother receiving this letter recently. Beginning January 1st, our hospitals and clinics will no longer be in Humana Medicare Advantage network, HealthPartners said in a statement. With many other good Medicare Advantage options available, we're committed to helping our patients ease the transition. So this typically you see something like this almost every year, usually every year, depending on the location or where these types of things happen, because they are isolated to different networks of providers and Medicare Advantage plans, because Medicare Advantage plans are by county. And so the insurance companies negotiate with the providers in those areas to agree to take their plans so that they can offer those plans to Medicare beneficiaries. So this is one really good example of why it's important to read the mail that you get. The last video I did, I talked about Medicare junk mail from a lead standpoint, but this is actually talking about the annual notice of change. This would actually come from your provider. So whatever provider that you have, you would want to check and see if you are getting mail from them, just to make sure you understand and know what changes are coming down the pipe. Anyways, that's just a quick video today. Hope you found it helpful. If you have any questions about Medicare, feel free to leave me a comment below. Otherwise, I hope you are subscribed to the channel so you don't miss any future uploads. Thanks for watching. Have a great day.